Thank you. Could I ask everyone to settle down, please? Kizom, the floor is all yours.
Thank you so much. And I don't know who didn't feel like dancing, but that was an amazing video. Welcome to everybody, and what a thrill and pleasure it is for me and all the panelists to join you here to talk about impact. We've had such a fantastic conversation over the last 2 days. Really, what's fantastic is that we've been waiting for the last 3 years to talk about impact, and that the upcoming AI summit is about impact, is what is bringing a lot of conversions across global north, global majority, development organizations, private sector, different countries, because we know that the world around us is shifting, but it is also creating some really unique opportunities. And we are here to talk today about some of the opportunities that are coming from the ground, from across many geographies. And I am thrilled that the star of today's panel are these amazing innovators from across the world. On stage, we have Tiago from Brazil. Tiago, please put your hand up. Tiago, he's been solving this teacher-student ratio to help improve student writing and literacy. And he's been on a fascinating journey across as an investor and an entrepreneur, leveraging networks for exponential change. And just in the last panel, we heard about what may we do to institutionalize some of the networks where the impact that are emerging can be exponential and global in nature. We also have Benjamin from Jacaranda Health, and he's been bringing AI to serve the needs of mothers at scale in health. We also have Almedi from Deep Leaf from Morocco, operating in a number of countries and helping farmers increase yield and reduce pesticides. And then we have Kidis from Zene Health in Ethiopia and Rwanda, looking at the supply chain solutions for healthcare providers to reach the remotest communities. And as you can see, this panel is about people. We'll certainly talk about AI, but it is about AI plus people. And it is about how that thrilling combination creates that safe impact at scale. Now, all of them are on stage because they've moved beyond the pilot stage. Zene Health, 50,000 women and growing. Jacaranda Health, serving 1.8 million mothers. And Benjamin, you're going to correct that number shortly, if it's more than that. Deep Leaf across 1 million hectares across a number of countries. And Tiago, you'll have to tell us what your number is. So I'm going to turn to you, and across my panel members, if you can just give us a sense of what has been your journey from 0 to 1 to exponential scale. How hard has that journey been? Where are the users in that journey? But also, can you talk about where is AI in that journey? Tiago, over to you.
Thank you. It's a pleasure to be here. I'm honored. So telling you a little bit about our journey. It's important to give some context. In Brazil, just 1 out of 10 adults can be considered fully literate, can read a high school book or write a 1-page dissertation. So it's a huge, huge problem. And when we try to understand where the problem is, obviously it's inside the school. And what we notice very clearly is that students, they don't have the chance to write regularly. And we know that the only way for you to learn how to read and to write is to practice, meaningful practice. And they don't have that opportunity. And when they have the chance to write, they don't have feedback. So that's a huge issue. And that's the problem we try to solve right in the beginning, 10 years ago. So 10 years ago, we look at that problem, And we tried to figure out how to solve it. And we didn't think about AI. We didn't think about technology, to be honest. But when we noticed and understood the problem they were trying to solve, the problem was that teachers were overloaded with work. They didn't have the time, the energy, and the compensation to really focus and spend time doing the assessment, the grading, and the support the students needed. So by then, we understood that technology could play a huge role in that process. So what we did was to develop our own AI back in 2015 that could really understand, comprehend students' writing, and give meaningful feedback right away. So that process of really understanding students' gaps and giving them clarity about what they have to focus allowed them to really improve their writing skills very, very quickly. So we started back then in 2015, 2019. We had the chance to run an RCT funded by JPAL, the lab at MIT, founded by Abhijit Banerjee and Stella Duflo, Nobel Prizes in Economics. And that RCT proved that our program really helped students improve writing skills very fast at scale. So after that RCT in 2019, we started to be demanded by governments in Brazil to run our program as their official writing and literacy program for students' skills development in literacy. So we've been scaling that program since then. We have covered and supported more than 4 million students since then, working as public policy, official public policy in different states and cities around Brazil. And right now, we're looking for an international expansion. We're exploring new markets that could fit our program to their needs. So in a nutshell, that's pretty much what our journey looks like.
Tiago, thank you so much for sharing. Can I probe you a little bit and ask, was there a problem in unlocking data? Did you have issues with access to compute? What about the linguistic and cultural diversity of Brazil?
Mm-hmm. That's a very core question. So back then, we didn't have data. We basically didn't have data. But we had something that was really special. We have a national exam in Brazil for the end of high school. And at the end of high school, they have a writing piece. They have an essay. And that essay is a huge data set. However, it was all manual. And at the time, there was no OCR. So what we did, we hired a lot of master's and doctoral students from the linguistics department of many universities for them to type the essays and start making linguistic notations so we could start identifying the standards, the patterns of those essays. And that was the initial data set we had. And once we had the students write on our platform, we started to make this corpus richer and more relevant. So it always started very small, very manually. And now, obviously, we don't have to do that anymore. But we still need the human piece improving and indicating to our AI what we have to do to be more precise, to be more assertive, and to give a better feedback for our students.
Tiago, thank you so much. We're going to come back to you, and I'm sure the audience has a lot of questions. Almadi, I turn to you. Tell us about your journey from Morocco to Bangladesh to Kenya. What are you doing, and how are you building these use cases for impact?
Thank you very much for having me here. So Deep Leaf journey started 3 years ago when we had the first yields lost due to pests, a pest attack on our tomato greenhouse in my hometown. The pest was Tuta absoluta, which is a flying pest insect that makes mines inside the tomato leaves. So farmers were confused how to treat this pest. Many agro dealers were taking this opportunity to sell their pesticides. So the farmers ended up using excessive pesticides. They had a lot of residues, and they weren't able to sell their produce anymore due to the regulations. Some farmers were exporting. They weren't able to export due to European regulations. So my father was one of those farmers, and that's where I had to come in and create a solution that will help farmers reduce chemicals. So we created a simple deep learning model using ResNet, which is an open source algorithm. We trained it on the images of this pest, and then we've been able to identify the early signs and provide organic treatments and preventive measures instead of chemical pesticides, because at the early stage of the detection of the pest, you're able to use these solutions, these alternatives. And then it worked, and we thought, why not scale it into multiple crops? We found that there were already many startups doing the same, but the AI models were fragmented. Every country develops AI models for disease detection for some crops that they have in their fields. Farmers need to do crop rotation, so they need to install other AI models. So you find a farmer mobile phone filled with different apps, different mobile AI models. Each one is specific for some crops, and each one has a different user experience and so on. And as you know, smallholder farmers, who are 80% of African farmers, can't actually learn every user experience. They can't even learn one of them. So we had to unite all of these crops under one AI model. We won some competitions where we got access to open data with the FAO. We trained the AI model on 57 crops, and now we are offering one API that allows you to detect 1,000 pests, disease, and nutrition deficiencies under one mobile app. Now we are in front of another challenge, which is affordability, making this affordable and accessible by smallholder farmers. So the solution for it is compute. And thanks to different initiatives, we've been able to access this compute. And now we provide it free for all the smallholders in Africa, currently at 5 million smallholders. And in order to unlock this growth, because farmers, even if it's affordable, you want to be able to reach them via social media or digital marketing means. So we pivoted from a mobile app into an API that integrates with existing platforms. And that's where collaboration comes. We started collaborating with different agri-tech companies from different countries of Africa and Middle East, integrating with their platform, enhancing their value proposition by adding this disease detection feature. And then we started discovering that this AI doesn't only diagnose and provides treatment, but it's fixing a huge food security problem that allows us to have use cases with governments, with banks, insurers, more segments in the market that we never imagined before. The first use case, which is the most important, so I can keep it short, I'll talk about it. It's the food security grants that governments provide to farmers so they can have access to treatment and fertilizer. The first customer was Qatar. There was a Deloitte report showing that 70% of their funding that goes to tenders and grants to get fertilizer go in for the wrong treatments, because the farmer doesn't have expertise or knowledge to discriminate between two different pathogens, because they have the same visual features. So they end up asking for fertilizer that's the wrong active ingredients, that have the wrong active ingredients. So the use case here is very simple. These mobile apps where farmers get access to treatment and fertilizer, instead of letting them manually choose from the list, they have to take a picture first, and then the AI will tell them which treatment they are eligible for. Then they get their voucher and go to the agro dealer to purchase. So that's how the journey been, from a problem that touched my community into a solution that feeds families in Africa, into a use case for food security programs.
Amazing, Almadi. Thank you so much for that illuminating journey. I now want to go to Ethiopia. Kidis.
Yes, thank you. Thank you all for having me and for joining us. So as mentioned, I'm from Ethiopia. And maybe I'll give a little context about Ethiopia for those that aren't familiar with it. So in Ethiopia, we're the second largest populous country in Africa. fast-growing population, fertility rates are quite high, and that's kind of where we come in as Yane Health, working on women's health. I know you mentioned we're in the supply chain earlier, but at the core of what we do is actually women's health and women's health commodities. In Ethiopia, when you look at the AI landscape, it's heavily government-driven, it's government-led. Since 2021, Ethiopia as a country has taken a commitment in being the AI hub spot for Africa and for innovation around AI and technology and improvement. So there has been a lot of investment and appetite from our government. However, private sector still has the strength in terms of innovation is coming from private sector. Use cases are coming from private sector. However, the regulatory landscape is still more favorable to government entities. So I think just with that understanding, it can show you as we're one of the ones that are in the health tech space that are trying to be a pioneer as a private sector actor and also build these use cases that are national priorities. For us at Yane Health, and I've kind of jotted things down, so I want to kind of share the journey in a way that can be useful for our discussion. AI doesn't start with a model. It starts with a young girl in her room on her phone, whispering or typing a question about, I'm pregnant, I don't know where to go, what do I do? How do I tell my parents? I think I may have caught an STD. What do I do? My menstruation hasn't been here for 2 months. Do I have a condition? It really starts with her problem, the stigma she's dealing with, and how do we provide that access for her where she feels safe? So I'm gonna again focus on kind of the experience around women that actually use our products. We are, just like Thiago as well, we didn't start off as an AI company. In fact, we still aren't an AI company. We're a healthcare provider for women's health. And in our early days, it was really thinking about how do we solve problems around women's reproductive health. Maternal and child health is a big issue for most sub-Saharan African countries, if not all. And same like Ethiopia, there are 27 million women of reproductive age that still today have an unmet need for accessing contraception, for accessing care and learning about these topics. We're not teaching young girls about menstruation in high schools. We're not teaching girls about sexual health and so on. So by the time they're experiencing their first instance of pregnancy or a condition they have, it's usually the first time where they're going to a facility to get treatment for it, which is too late oftentimes. So that's kind of where we started. And I think the key thing around that is, for us, we have to remember that behind every tool and behind any solution, there is a person dealing with a problem. And that's kind of been the lens and how we started at Yane Health. So today at Yane Health, we are a mobile application that provides multiple features for women. We have an online, we have a mobile period and menstrual and pregnancy tracking feature on the app. We have an online educational portal where they can learn about SRH, sexual reproductive health, maternal health topics without stigma in their own language. And then we have an online telehealth service and online pharmacy, so they can access practitioners privately, discreetly, via video chat and audio, and also get prescriptions delivered to their home stigma-free and discreetly. Now within that, we have multiple use cases that we've kind of been piloting and trying in the last couple of years. We relaunched our app officially last year, actually, so we've seen fast, rapid growth in our app and uptake of women. But when we started, day one, we didn't have data. We didn't have an idea of, what would be most efficient. And we really honed in on the human-centered design as part of our development with our product. So in the early days, we really gathered a lot of women for focus group discussions. We had online surveys. We gathered women in communities. We went to facilities to kind of talk to women and listen to them. We really listened. What is your problem? What are you experiencing in this? What are the gaps? And those early day discussions have really shaped to the use cases that we're prioritizing today. So again, with Ethiopia being a government-led and healthcare services are provided, over 80% of the market is provided by government in Ethiopia. So private sector doesn't have a stronger market share yet. And a lot of the data sits within government. And because Ethiopia is still at its infancy of AI, data privacy, data sharing policies, it's been difficult for us to get anonymized data from government as well, to build AI models to help with our menstrual tracker or pregnancy early detection and so on. So we've had to really start with the data that we had, and it wasn't much in the early days, right? We were dealing with thousands of data points, not enough, but it still was enough to understand what questions women were asking. We started an online a Telegram chat bot, actually in our first use case with our AI chat, where we just we're seeing how are women asking questions, what time were they asking questions, what languages did they prefer, were they using emojis, were they using different dialects, which really helped us understand the human aspect of it. We even went into different regions to talk to women from different socioeconomic classes and tried to understand, what is their understanding of technology and AI. And interestingly, in one community we went to, women, it was a conservative region and community where they're very religious, and they felt like AI was evil. They really believed that, how can something that doesn't know me tell me what I need? And the fact that they were sharing intimate information about their sexual health, their maternal health, their reproductive health, they felt like it was going against their personal beliefs, religion, but also they were like, can I even trust the system? Is there somebody that actually can validate this? Is there a provider behind this? So we really got a chance to see it from that level of, there has to be a lot of advocacy done around what AI is, especially when you're providing healthcare services that requires trust at the core. And I think that was one of the biggest challenges. First is like, forget about the data and what we can build, but if the users don't feel confident in the system and the tool that they're using, we're not going to reach impact. Our AI model or any AI model can be 95, 99% accurate, but if the user doesn't feel trust and feel confident and feel like their information is private when they use it, there's really no impact that we're going to see. So I think that really helped us shape it. And also we went multiple times back to our platform on our app, on our bot, to redesign the app. We even, in fact, had a researcher do a human-centered design study on our UX and UI in terms of how do we engage, what is the tone of our messaging when we're talking to women about these topics. It can't be robotic and feel very static. It has to feel like there's a person behind there that actually cares. We had to change the tone of our messaging. We had to change, put in guardrails that won't say things that would impact or that would influence people based on their religious background or their cultural beliefs. So a lot of these things happened when we brought in the users into that building the product. And today, where we're at, we're not at national wide scale of our solution and our different use cases, that we're experimenting with. However, we have a clear path of how we need to build and what areas we have to really focus on as a B2C provider, where the end user really has to understand what they're using, and not really spending a lot of money on, the technicalities of it, but really also focusing on the user experience of these tools. And I'm sure there's more questions we can unpack, but that's pretty much what we do. I guess in terms of use cases, like I said, on our app, we forecast and predict women's menstrual cycles. We also notify them on early danger warning signs for pregnancy challenges. We recommend different contraceptives or services if they're planning to conceive, or if they are planning to get on a birth control. We help them decide what's the best option for them based on the input that they use. So it's really personalizing their care. And also we're experimenting with triaging patients to our telehealth service. So really telling them who they should be talking to and speaking to quickly, but also in a way that is safe and that they understand. And we're always being responsive as well. So that's what we're doing today. We don't want to reinvent the wheel. So we always think about collaboration. We work closely with the government as well, leveraging their infrastructure and their resources. But the biggest thing that has got us this far so far as a startup as well has been the financing piece of it. We want to be sustainable. We are a social enterprise. We're not an NGO. We need to ensure that this tool will also survive for a long term. So I think these types of things have been core to how we've built our tool so far.
Thank you so much, Kidis. And now over to you, Benjamin. Please tell us about Jacaranda Health and your journey.
Thank you for having me. And I'll start by correcting the number. We've served 3 million moms so far. We've served 3 million moms so far, not 1. Yes.
3 million moms, okay.
Yes. So just to give a little bit of context of why Jacaranda does what it does. An average American woman will ask Google 1,000 questions during their pregnancy journey. But back at home in Kenya, our moms don't even have access to phones. They do, so they don't even have access to the internet. So anytime they want information, the closest place they can get this information is their friends. And I don't know about you, but if I took advice from my friends all the time, I'll probably be in jail right now. But yeah, so from that, we thought, how could we empower these women through their pregnancy journey and their newborns after they give birth? And just like Tiago, we didn't start with AI. We had a bunch of help desk clinicians sit, and we provided an SMS platform that moms could just ask us questions. And at that point, we were processing at least 100 questions a day. That's easy to handle, right? 2 people can handle that. But then two problems showed up. One, we had really benign questions being asked. And most of these came from culture and beliefs. Things like, can I eat eggs? Can I eat avocados during my pregnancy? And I don't think anyone wants to sit and answer 100 can I eat avocados question at work. It becomes boring. And the other thing was we could quickly see that those questions will easily move from 100 to 1,000 to 10,000 to 12,000, which we handle right now. We process 12,000 questions a day. And the question was, how do we serve the mom, one, faster? And how do we make it easy for our help desk agents? Because, again, we don't want to work with people who are bored at work because we are asking them if we can eat eggs during pregnancy. So that's where we started thinking about technology that we could use to at least help the help desk agents, the human help desk agents that were answering mom's questions. And at that point, our first hurdle came, which was moms in Kenya, and I think this has been mentioned a lot as something that happens here in India. There's no conversation that just has one language. When we are talking to each other in Kenya, we would mix mostly English and Swahili. And at that time, most LLMs were really good at English, but they knew nothing about Swahili. And the Swahili they knew was more like the university Swahili, which no one uses in their day-to-day conversations. So our first hurdle was to figure out how do we get a model that can understand Swahili that everyone speaks. And that's how we built, based on Llama 2, that's how we built Uliza Llama, which basically means ask Llama. We trained this model with data that was given to us, at least by the government, and then for data that we had to hire people to translate, so manually, because at that time we also didn't have a lot of the tech for very good translation like we do right now. And then after that, from the previous questions that we had, where help desk agents were responding, we had at least 1,000 questions and answers. We used that as context for the things that we would expect our moms to ask. So that, in combination with policies and other documents from the Ministry of Health, the WHO, to give that model the context that it needs to respond to our moms. And that model we called Uliza Mama, which means ask a mom. So at that point, we had something that we thought worked, and we put it out to moms, and we quickly started learning that this is not what they wanted. Moms do not want, as much as you're giving them clinically accurate information, they do not want you just texting them without even saying hi. They do not want you telling them, a good example was given the other day, they do not want you telling them, you'll die, don't worry. No, they want you to have some empathy when giving them this information. And we had to iterate and fine-tune the model for these specific things. And the other thing was we wanted to know if we are actually delivering value for these moms. And the only way to do so is to ask the moms themselves. I mean, you could do a bunch of studies around that, but if you're not talking to the actual user, then you're not necessarily getting the feedback that you need. And one of the things we added was making sure that after every response that we give the mom, we actually ask them if we're providing value to them. And that created a basis for what we want our model to do and how we want it to work. And over the years, we've fine-tuned that to the point where now we're identifying risks in the questions that they're asking, and that's where we've still kept the human in the loop. Because we do not want a situation where a mom is portraying some risk in their pregnancy and still want a machine responding to them. So anytime we have danger signs, those are handled by still our human help desk, who would call them and direct them to, for referrals and how to seek further care. Yeah, so I think that's the journey of Jacaranda.
Benjamin, thank you so much. Great stories, everyone. Thank you for sharing so generously with us. Benjamin, may I ask, you talked about making the model talk in Swahili and in spoken Swahili. Was there any voice and text database that you leveraged or contributed to? Second, I wanted to ask you about compute, because it's come up often as one of your critical scale challenges, and would love to just hear from you for the audience what that means.
Yeah, we leveraged a lot of data that our partners, mostly the Ministry of Health and Education, had. The Ministry of Education helped us with Swahili text that we could use to train our models. And then the data set that we had collected before we started using AI really came in handy, because then moms texted at us a lot in Swahili, and at least the 1 million questions and answers helped us in that case. When it comes to compute, I think it's a challenge, like everyone else has mentioned, and we have had support from a couple of people, and Amazon and Google giving us credits to be able to deploy and run our models. But right now, what we're trying to do is to now come up with frameworks and policies to set up that kind of compute in conjunction with the government in Kenya, so that we can also subsidize the costing, the unit cost per SMS that we send out. Because let's be real, credits won't exist forever. So we need to figure out how to be self-sustaining as organizations working with the government.
You mean how to not just access, but also afford the compute?
Yes.
Okay, great. And we'll hear more about it in the next panel, about some of these horizontal unlocks. I'm going to just actually, if you agree with me, my panel members, let's just go to the audience. We'd love to take a few questions and then come back again to some deep dives. We have a question already there.
Both Thiago and Almadi, you talked about going global after starting in your countries respectively. If you could share in this outreach a case study of a country that you've gone into with two things. What have you done for the data set to capture, for the languages, and for you, for the crop advisory that you're providing? And what are you doing for the language? Because in Brazil and where you've started, is it just that, or there's a replication or an enhancement with the language set that you're doing?
So for our international expansion, we are in a phase where we are investigating where we should go based on different criteria, complexity, level of investment we need, the investment we're going to have to do in adapting our product, market dynamics, and so on. So it's a business plus technical analysis for us to make that decision. We are starting with Latin America because it's culturally very connected to what we have. In terms of curriculum, is also quite similar to other countries. In terms of language, Spanish and Portuguese are also very similar. But the plan, once we decide what country we should go, we will have first run a pilot to understand what kind of data we need. So we don't know in advance what kind of text types or essays or school segment we're going to work in. And once we understand, then we'll have to seek that data set, which it will be basically students writing, right? Our data set are students writing, and not only student writing, but students writing with a set of analysis that can give us the information about that data set. Probably we will have to hire, again, linguistics to help us understand very specific traits of those essays related to the rubric that we will have to give as feedback for the student. So we'll be able to avoid that human capacity to really refine data set. Like the idea that you just have to, you know, we have an AI, generative AI, and then you ask GPT to like give me a feedback based on this kind of criteria, this rubric. It's just a mess. We have that experience that doesn't work. We really need a moment of refining students' data set so we can start working with precision.
Thank you very much for the question. So at Debrief, it's almost the same thing. We have this data X product flywheel. So the more data we capture, the more products we can cover, more crops. And once you cover more crops, you can cover another geography where farmers are cultivating that crop. For example, when we started in Morocco, we started with tomatoes because it was very obvious because Morocco is exporting a lot of cherry tomatoes to Europe, specifically UK, Spain, France, and so on, and grape. So the second crop was grape. Once we developed this model in Morocco, the first idea was to look into every market where we have an opportunity of entry, where farmers cultivate tomatoes and grapes. And that's where we found that it's not the right approach, because we can't actually just go to any country on our own. And most governments require you to register your company locally so you can work with them and so on. So we had to switch. Instead of trying to put our mobile app in the market and give it to smallholders, we have to create an API where local partners can do the implementation. So that's when we started partnering with large agribusinesses, with agri-tech startups, with insurance and banks who are interested in this solution, either in the diagnosis itself by subsidizing it to the farmers if it was a government entity, or by reselling it if it was an agri-tech company, or by just buying the data if it was an insurance or a bank. That's how we actually unlocked the expansion issue, and were able to also collect and co-build the data set with these partners on the ground. So, for example, when we went to Kenya after Morocco, the first thing we've done is collaborate with a bank there who already have many collaborations with universities there. They already have the data set ready. So we just captured the data, trained the AI, started providing diagnosis to farmers who are subscribed to the bank services, either getting loans from the bank or they are insured. Same thing in Qatar. When we met the food security program there, we had to train and fine-tune our AI on leafy greens and on zucchini and lettuce and palm trees. So again, we contacted the local universities, agronomic research institutions who have the data sets. We created a fine-tuned AI model on these crops, then started selling. We found out that this API approach works better because we are creating value for partners globally instead of trying to go directly to the farmers. Now for the linguistic part, since we are providing treatment recommendations in natural language, we had to make sure that it's adapted to the local language. We had to make sure that the farmer will understand the response that we are generating. And for our case, it's not only about translating it into the native language, but also making it contextualized, because not every country have the same authorized pesticides. Every country have its own index of authorized pesticides. So we had to not only translate, but also remove all the unauthorized active ingredients and replace it with the authorized ones, provide the right dosage, the right application. For example, how many applications, what is the delay between each, and what is the delay before harvest, so you can have 0% residues. So this work was possible thanks to the API approach, because when you have an API and implementing partners, these partners are localized. They already know what is the list of the authorized treatments. They already know the entire regulation around phytosanitary. So they share with us this list. We fine-tune our knowledge base. We remove all the unauthorized active ingredients, and then we are able to provide recommendations in that country. And thanks to this API approach, we are now able to provide our treatment recommendations in up to 50 different languages. And we don't have to redo it every time, because we just translate it one time, because it's a static knowledge base. Whenever you detect disease or pest or nutrition deficiency X, we give you the same response as we give to every other farmer who detected the same issue.
Great, we'll take one more question. My God, many hands are going up. How shall we choose? I've already made eye contact with you, so please go ahead.
I didn't think this was working. This is working, yes. Radhika Mittal, Research Program Manager and Impact Lead for Ethics of Socially Disruptive Technologies. It's a Dutch ministry grant on understanding ethics. So I'm very curious, because I hear, of course, for agriculture, maybe this is a bit different, but for health-related sectors, I'm glad that you're talking about the user ecosystem and building trust and building, tapping into beliefs and habits to collect data. But I'm wondering about the safety of the data sets that are gathered, and how do you kind of navigate that loophole? Because this is becoming a big issue, right? Are there regulatory frameworks in place for you from your end as organizations? Because of course it's great for digital advancement and transformation, but it's when you go beyond business, how do you tackle user agency, autonomy, and well-being while collecting this data and then protecting this data?
We have a volunteer. Benjamin, you're going to kindly answer, but I did want to preface before you come in to say that there was someone who raised the question of the involvement of academic institutions, especially academic institutions in the social sciences. And as we were workshopping across, figuring out some how to create safe impact at scale, how do we institutionalize networks where we can discover each other, solve problems together, or even help unlock what someone else needs that I can provide. And one of the challenge areas to scale that did come up was academic institutions that we need to work more closely with. Now, of course, there were a lot of institutes that were talking about steerability of models, benchmarking of models, and that is very important when we're talking about how these LLMs will work in Global South contexts and India has been doing remarkable work in creating that linguistic diversity and context, and much of what these use cases are building become the commons inputs into these models as well. But there is this ongoing need to connect the dots with the rigor of the academic research and social sciences as well. That as a community, we've really taken that away as one of our sort of must-have, must-include, must-network better. So I just wanted to say that to you, and Benjamin, please.
Yeah, I think we've looked at this issue in a couple of ways. And the first and the big piece for us is having a clinical quality assurance team within the organization that allows us, helps us evaluate the data sets that we're using to train. And then periodically make sure that they're evaluating whatever the AI is giving out. Again, just to make sure that it's safe, but processing 6 million questions is also can be overwhelming for that team. So what we've done in addition to that, we're also using an LLM as a judge, where Llama would give us, or Ulizamama would give us the answer, but then would have GPT audit that answer for the things that I mentioned earlier. Does the answer greet the mom? Is the answer medically correct? Does it have empathy? How's the agent behaving within this answer? And one of the rules that we've set is for 2 things. When 2 things happen, the answers don't go to the moms direct. They have to be looked at by a human. 1 is when we detect a danger sign, and 2, when we detect a danger sign, that goes to the human help desk, and 2 is when it fails audit. If you asked a question about avocados, but then it fails audit, unfortunately, the human has to look at it. So that's around the data that we ingest and the data that we give out. But while building the platform itself, privacy is key. So one thing that we do is we do not collect data that we don't use. If we do not need your name just to answer your avocado question, we're not going to ask you for your name. And also, if you have no business accessing that data, then you do not have the rights to access that data. So we've built in privacy in our design for the platform. Yeah.
So I wanted to give my perspective. So at Deep Leaf, we are working on pest and disease images. Before processing these images, before training the AI on it, we start firstly with our agricultural team. It's led by my uncle, who's our chief research officer with 30 years of disease science, plant disease science, phytopathology. So we are making sure that the labels are correct of every disease that we have. Same thing for the knowledge base. Every active ingredient that we recommend goes through different tests before providing it to the farmer at the end. But that's not the issue. The data sets that we train the AI on can be curated, can be tested and filtered before doing the training. What companies cannot control really is the real-time input that the farmer gives them when we are doing the inference, during the inference. And there is a famous quote that we have in software development. I think it applies on every other field, which is garbage in, garbage out. If you give AI random data that doesn't fit, he will give you bad response, inaccurate response, and the AI itself won't be even able to find out and won't give you, he will still give you the response with high accuracy, with high confidence. So what we have done at Deep Leaf, we focused on that garbage in. We created a simple TensorFlow Lite model that runs offline on the mobile phone that tells the farmer in real time to get close to the leaf, position yourself correctly, clean the lens if the AI detects that there is some unfocus, or there is no plant in the image, and so on. This is a solution that allowed us to have the perfect input for the AI. Once you have the perfect input, of course, you will get better response at the end. And once we implemented this, it was a year ago, we've been able to increase our confidence level with up to 96%. Most AI models, when they are classifying images now, they are limited at around 80% confidence. Confidence, not accuracy, which is very different. Accuracy is a metric that we get when we are doing the training, but during the inference, that's confidence, which is different. So at Deep Leaf, this is a solution that we've been using.
Thank you so much, Almedi. So we have about 10 minutes left, and I wanted to turn back to the panel members. We've had many aha moments over the last 2 days. But, you know, as Debjani said in the last panel, we're going to keep having aha moments because, you know, we'll come together in meetings or virtually or in person and we'll say, wow, I did not know you were doing this. Even in the same country, even across borders. So I just want to turn to you guys, like, you know, how do we continue collaboration? How do you continue collaboration in countries? How do we continue collaboration as a global network? What are some ideas or takeaways that you would leave us with before we close the panel? And Kidis, would you like to start?
Sure, I was just thinking about that. It's been
If you want more time, we'll put Tiago on the pedestal.
Yeah, and I mean, this has been a reflection, I think, for all of us since yesterday. You know, there's a big challenge around collaboration and coordination, and I think it's not something we're going to answer today, but it's something we definitely will continue to think about. I think, you know, from our journey, I think we've definitely seen that there's so much duplication of efforts into all of these use cases that we're building and interventions we're coming up with. And I think it really starts with first understanding and knowing who's doing what, right? Understanding who's doing what and who should play which role. Now, one thing in our country, in Ethiopia, the challenge has been, you know, government should be an enabler for AI tools, creating policies that are enabling for private sector to engage and build and innovate and integrate. Interoperability is a big issue, but we don't have that. But now in our country, we're seeing government lead in building tools, which is undermining private sector to actually engage. And, you know, it's creating this almost toxic competition where at the end, it's not impacting the users at the end. So I think based on, of course, where we are, there needs to be a clear understanding of, you know, what role do we have? And I think even for our journey, when we started, again, we didn't start off as an AI company, but you want to, you know, we all try to build these language models and different fine-tuning of models that somebody else is already doing. So I think before we start building, I think that should be all of our assignment, is to really think about who's already doing this that we can collaborate with and partner with and stop ourselves from reinventing that. Because I think I see that also in the conversations here. It's a similar thing. So I think if we think about taking that as a step to say, let's see what's going on and then plug in, see where we can plug in. Like, I love the model, you know, that you mentioned has helped, that has helped you scale with the API where you're not trying to reinvent the wheel. So I think really being conscious about that. And I'll just say that I think the challenge is not technical, it's institutional. So I think we have to think about it on that perspective as well. I really think about how we can make it work. But again, it's something that we have to reflect on beyond this conversation to come up with something tangible.
Someone very rightly this morning said access to justice is a logistics issue. You know, it's not a technology issue or a legal issue. Yeah.
Yeah, so first of all, about this collaboration challenge, I would like to say that this is my first time in India, the first time in a conference like this, and to see the way that the organizers and the people around made it happen, and the quality of the dynamics, the quality of the interactions is really, really impressive. I could never see this happening in Brazil, for instance. I think that collaboration in Brazil, we have a much higher challenge, a cultural challenge to understand what collaboration really means. Because In Brazil, at least, we see collaboration as a transaction opportunity, like what you give to me, what I give to you, rather than here, it seems like collaboration is clearly a requirement for a structural change. And I think that culturally speaking, you guys are way ahead of us, and we have lots to learn with you guys. So this has been an amazing learning experience for me. But going to collaboration and what I see and what I believe that can really lead us to impactful collaboration are two things. I think the first one is mission alignment. We do have organizations working with education, with equity, and whatever. But at the end of the day, each one of them are looking for very specific problems, very specific challenges, and it's harder to connect to the same exact mission. And this mission is not only a concept, it must be a number, must be a metric, must be measured, must be very, very clearly defined for all of us. So mission alignment and I wouldn't say incentives alignment, but incentives clarity. Because usually when we have different organizations working together and collaborating, they're seeking something different. And to make sure that that's transparent and that's, there is a conversion of incentives is really important. And I think this is a way to start off a new collaboration, like our mission alignment, our incentives. Is there a conflict in our incentives, or they can really foster each other? So I think this would be like the first steps I would give to think about collaboration, systemic collaboration. And I think that for the problems that we're trying to tackle, there's no way of reaching scale, exponential change without collaboration.
Thank you so much, Tiago. Benjamin, would you like to go next, and then we'll close with you, Almedi?
Yeah, I think building on the incentives piece, I think one thing that would drive collaboration is funders and donors not funding the same things, and figuring out a way to connect people who are doing the same things and maybe fund them as a whole instead of looking at deliverables of the same thing from two different people or two different organizations across the continent. Because I think not just with AI-based tools, even with just the traditional digital health tools, that's one of the things that has driven the fragmentation that we're currently seeing in the health sector.
Thank you, Benjamin. He's giving us something new to reflect on, but absolutely well noted. Almedi, over to you.
I want to build up on what the panelists said. From a technical perspective, I find that every time I go to an event, there must be someone who has strong synergy with what we are doing. And the issue that I find is priorities and focus. So we have a lot of synergies, but it's very hard to identify what is the focus that we should make in order to make this synergy produce something meaningful. So from a technical perspective, speaking of APIs, I see a lot of companies here or in other events who are providing something, but they are producing some data that they don't actually leverage and can be leveraged by the other companies around them. So I think one of the recommendations I would say is to share this information, try to do data exchange, because sometimes you don't know what opportunity relies in the data that you're gathering by doing what you're doing. But when you're sharing about what you do with other innovators in the room, they are able to find out that you have that data they are missing. Data can be anything. It can't be only images or text. It can also be ideas, entries to new markets, and so on. So I want to emphasize on this point, try to share as much as possible. Not everyone sees the world the same way you do. Maybe some opportunities that you see and you find irrelevant are relevant for others. So I want to emphasize on sharing. because sharing is caring, as they say.
Thank you so much to all the panel members. Very insightful. I'm sorry, audience, that we didn't have more time to take more questions, but our panel members will be around in the room and outside over tea break, so please take every opportunity to reach out to them. As Archana was saying in the panel before, the new AI era has started. It is the era of impact, and impact is going to be messy. It's not going to be perfect. Collaboration will be required, not just in an event or in a meeting, but as a continuum. So we're really looking forward to working together with everybody. For me, from the United Nations Development Program and the AI Hub for Sustainable Development, we're going to, looking forward to safe impact at scale, our new tagline. Thank you so much for making AI about people. A round of applause.
Thank you, panelists, for a truly insightful discussion.